Fox.
All right, welcome back, everyone. Dr. Rollins joins us. We're talking about testosterone replacement therapy, something that's been in the news recently, and some new developments.
Yeah, there's been a lot of attention to it. You know, first of all, over the last 4, 5, 6 years, you've seen more and more commercials for testosterone. It's kind of been touted as the fountain of youth. It's not the fountain of youth, but it's pretty amazing what it can do for men who are low on testosterone. And then just recently, within the last year or so, there have been a couple studies that have kind of thrown a monkey wrench in what we thought about testosterone and heart disease. Now, there's lots of studies that show testosterone is very good for the heart, but just within the last couple years, there were a few studies that suggested a link between testosterone replacement and an increased risk of heart disease. And so there's been some controversy about these. Now, that's given the FDA cause to add some warnings. You've probably seen the commercials on TV. Have you been injured by testosterone from the attorneys? You know, I do a seminar on testosterone replacement, and I've specialized in the replacement of testosterone for men and women for almost 2 decades, so I've got a lot of opinions about this and a lot of background with it. And you know, there have been some major groups, some of the European medical groups have come out and said, no, we don't think there's a risk between testosterone replacement and heart disease. So there's definitely confounding studies, and a part of what we go through in the seminar, like most of our seminars, is we get into the details of that. So tonight we have a free seminar on testosterone replacement for men. Women need testosterone too, by the way, but we're going to get into a lot of details and look at these studies. But I want to say that if you're low on testosterone, men and women, a lot of common symptoms would be fatigue, lack of energy, low sex drive, interesting mental things. You know, a lot of men are misdiagnosed as being depressed when they're low on testosterone. And they're not necessarily depressed, it's the wrong diagnosis. They just feel bad. You know, they've got no get up and go, no motivation, their confidence and security may be lacking. So a lot of interesting mental things happen with low testosterone, and they improve when you replace testosterone.
Okay, so depression's more of like a side effect of...
That's a good way to look at it, yeah. A lot of the lack of energy, lack of interest in activities, these are things we use to diagnose depression, but that can be the same thing with low hormones. And it's not just testosterone, other hormones too can cause a lot of mental changes.
Sure, absolutely. All right, well, do you care to offer a brief hint on your thoughts on this, or are you going to make people come to the seminar tonight?
Well, you know,
okay
as far as the studies go, again, there's conflicting studies, and that's what we'll look at, some of the details.
Sure.
Some of the studies have some methodology problems. There's some of them that they didn't really monitor things as well as they should be. There's some debate about, does it matter when you start testosterone? If you wait until someone already has unstable heart disease, there may be a parallel like we see in women. There's still a lot to be learned from it, but we try and make sense of it all.
Absolutely.
That's the bottom line.
All right, what time, where can they go?
So the seminar's tonight at 6 p.m. at the Integrative Medicine Center. Like all our seminars, they're free to the public, and we encourage you to come if you're interested in learning more about testosterone.
All right, fantastic. Need to RSVP, or can they just show up?
If they RSVP, that's great. If they don't get a chance to, that's great too.
All right, sounds terrific. And there's the info right there on your screen. Dr. Rollins, thank you so much.
Thank you.
And we'll be right back after the break.